Go.
Usted aprenderá acerca de Mexico Salud. The information that I will present to you in this speech is in order based on country. I will talk about Mexico first and then the United States. By the end of my speech, I hope that you will be able to know the differences between the healthcare. You might need to know in the future, but I hope not. Hospitals and clinics run by the INSS, which stands for Spanish Institution, and I'm not going to try to say that. They are available to all Mexicans and foreigners who hold jobs. A portion of the salary is withheld to cover affiliations, and the employer contributes a large amount each month to complete the premium. In addition, self-employed people and retirees may also join the system after taking care of the paperwork and paying the annual fee. Some pre-existing conditions may not be covered. IMSS services cover doctors, diagnostic studies such as x-rays and lab work, hospitals and medical procedures, as well as prescription drugs. As with all socialized medical systems, the wait for care is usually longer than that of a private system. Many experts consider IMSS affiliation as a kind of major medical insurance should the need arise. Out-of-pocket payments by patients represent over half of financing for the Mexican healthcare system, according to the WHO. Government expenditures account for 44% of healthcare spending. On average, an office visit with a doctor, specialists included, will cost 250 to 300 pesos, which is about $25. A house call, yes, doctors in Mexico make house calls still, will cost about the same. Lab tests will cost about a third of what they cost in the U.S. A CAT scan often costs about 25% of what it does in the U.S. An overnight stay in a private hospital room costs about 1,000 pesos, which is $77. A visit to a dentist for teeth cleaning costs about 300 pesos, which is $23. The United States is the only industrialized democracy that doesn't provide health care for all its citizens. Of course, we'd like to cover all of the 50 million uninsured, but how would you pay for it? In fact, we could. The conscious view among healthcare policy experts is that Americans pour enough money into healthcare, a $2.6 trillion industry, to have universal coverage. In total, healthcare spending accounted for 17.9% of the national gross domestic product, GDP, in 2010. Starting in 2014, if your income is less than the equivalent of about $88,000 of a family of 4 today, and your job doesn't offer affordable coverage, you may get tax credits to help pay for insurance, and if your employer doesn't offer insurance, you will be able to buy insurance directly in the health insurance marketplace. That gives you power similar to what large businesses and members of Congress have to get better choices and lower prices. In conclusion, as you see, there are many differences between both of these healthcare systems, but none of the healthcare service systems in the world are perfect. We are changing and growing each year. As you might have already known, I have been to a Hispanic country and have personally seen Hispanic facilities. I hope one day you will all get the chance to experience that yourself. The references were from www.pbs.com, www.mexconnect.com, internationalliving.com, and www.healthcare.gov. Thank you.